ما تنساش تعمل اشتراك في القناة. يلا بينا.
Welcome to HAZCOM Central. I'm Barry Lerner with today's HAZCOM report number 8, which we call Health Hazards 1, Toxic Chemicals. Understanding how to handle toxic chemicals safely has been a concern of industry for many years, and for good reason, because these chemicals can damage your health if the exposure isn't controlled. In a previous program, we talked about the physical hazards that call attention to themselves by heating up, smoking, catching fire, or exploding. Toxic chemicals, however, are sneakier. If you're not careful with them, they can make you sick before you realize you're being exposed to their toxicity. What is toxicity? To find out, we'll refer to the HAZCOM glossary, an easy-to-use guide that helps you understand the terms you'll find on labels and in the MSDS. It says that toxicity is the total of adverse effects resulting from exposure to a chemical. Even plain water can be toxic if you drink enough of it at one time, but some chemicals are inherently more toxic than water. That's why it's so important to keep the household products like chlorine bleach away from children who might drink a little and become immediately sick. You're not likely to drink toxic chemicals at work, but they can injure you in other ways. Right now, we have an interview lined up to illustrate how this can happen when people take hazardous chemicals for granted. We're going to talk to George Green, a maintenance worker who ran into trouble while performing a routine job. Welcome to the HAZCOM report, George. Tell us what happened.
Well, I think I'm pretty careful with chemicals that I'm not familiar with. But I've been using the actine solvent for years to clean parts and never had a problem. But this time something happened that kind of scared me. You see, I was cleaning compressor parts just like I've done 100 times, I guess. And I always wear my rubber gloves because this stuff can really burn your skin after a while. Then all of a sudden, I began to feel funny. First thing I noticed, my eyes started burning, and then I got kind of dizzy and sick to my stomach. I had to grab hold of the bench to keep my balance. And then I got real short of breath. I thought maybe I was coming down with the flu or something. My wife had the flu last week.
Sounds pretty bad, and you had no idea what was causing it.
Not a bit, really. I stumbled over to the other side of the room and sat down a minute, and after my head cleared, I managed to get up and make my way to the infirmary.
George, we'll come back to you later to find out what the doctor diagnosed, but now we have some other points to cover with our viewers. Thanks for joining us. George's symptoms sound a lot like acute effects of overexposure to a toxic chemical. Let's review what that means with our glossary. An acute effect is something you notice right away, and it can be slight or severe in intensity. Overexposure can also result in a long-term or chronic effect. You may not notice the effects until days, weeks, or even years have passed, and they can keep coming back like a recurring skin rash, respiratory problem, or numbness in your hands or feet. Having an awareness of the symptoms of overexposure can help you act quickly to limit the damage. There are 4 common symptoms of overexposure. Your eyes, nose, or throat may become irritated. You may experience burning or itching of the skin. Dizziness or becoming sick to your stomach is another warning sign. Or you may become short of breath or feel a tightness in your chest. To help us recognize and protect ourselves in the workplace, OSHA has developed some standard classifications for identifying toxic chemicals. To learn what they are, we'll go to our resident expert, Professor Sharp.
Thank you, Barry. I'm Professor Sharp, and I'm here today to talk about some of the terminology you need to know to understand toxic chemicals. Now, the textbook is going to be the HAZCOM glossary. Now, OSHA classifies toxic substances into 2 broad categories based primarily on the results of laboratory tests on animals. They are toxic and highly toxic. Now, highly toxic chemicals can be fatal even in small doses, and some of these chemicals, such as cyanide and mercury, are commonly referred to as poisons. The toxic class of chemicals, such as these, are less dangerous if swallowed, inhaled, or absorbed through the skin, but they can be harmful or even fatal if the dose is high enough. How do you know how toxic a chemical is? OSHA's primary measures are the LC50 and the LD50 tests, and you'll see the results of these tests on the MSDS for a toxic chemical. Now, basically, the LC50 value is the concentration of the material in the air that will kill 50% of the test animals which inhale it in a single exposure. The LD50 value is a single dose that will kill 50% of the test animals when administered orally or applied to the skin. In other words, the lower the LC50 and LD50 value of a chemical, the more toxic it is. Now, another way we can judge the danger or exposure to a toxic chemical is by the TLV, or threshold limit value, shown on the MSDS. That's the airborne concentration that a person can be repeatedly exposed to without adverse health effects. We can compare the TLV for different chemicals to see which is more toxic, as long as they have the same health effects. Acetone and methyl acetate, for example, are both solvents that can depress the central nervous system if inhaled, but you can see that the TLV for methyl acetate is much lower than acetone. So, methyl acetate is more hazardous. Well, that about takes care of the basic terminology. And now back to Barry.
Thanks for that lesson, Professor. The effect that a toxic chemical has on an individual depends on a number of factors. For example, how the toxins enter the body affects the level of risk, as does the amount or dosage. Healthy people usually can resist toxic effects better than those who aren't. And environmental factors like temperature can make a difference. And mixtures of hazardous substances present a special problem because they can intensify or multiply the damage. Understanding how toxic chemicals can enter your body will help you know how to keep them out. For a taped report on toxic entry routes, we go now to an industrial hygienist at a local plant where they handle toxic chemicals.
As an industrial hygienist, one of my jobs is to see that our employees are protected from toxic chemicals. One of our employees has joined me today to help me demonstrate how we do that. There are three primary ways toxic chemicals can enter the body: inhalation, absorption, and ingestion. Now, each presents a different challenge to prevent overexposure. The most common point of entry is through the nose and mouth by breathing contaminated air. We use various testing devices to determine the level of concentration in each work area and compare it with the recommended limits on our MSDS. If it is too high, we equip workers with a respirator like this. Toxics can also be absorbed through the skin. To prevent that possibility, we use protective clothing and gloves like these, made from the appropriate materials. We also make sure they fit properly, especially the masks. Then there's ingestion, usually by eating contaminated food. What have you learned about that?
Well, first of all, whenever we finish a job, we make sure we wash off any chemicals that get on us. And if our clothing's contaminated, we change. It's also smart to scrub your hands real well before you eat anything or smoke. And we don't eat in places where chemicals are stored either.
We can also limit exposure by planning and implementing better controls. I'd like to show you some examples of how that works. Sometimes we can eliminate a toxic substance from our process or substitute a less toxic chemical. Hazardous chemicals can be isolated from people with closed piping systems, and we can isolate people from hazardous operations by using remote control systems. No one method is right in every case, but by a combination of good planning, the use of proper protective equipment, and thorough training, we can go a long way toward minimizing the dangers of toxic chemicals.
We've seen how hazardous chemicals can enter the body and some ways to prevent that from happening. Now, to understand what effect those chemicals can have if you should be exposed, we're going to an interview that was taped earlier. Dr. Rosemary Brock is a company physician for the Plains Chemical Company. Welcome to the HazCom Report, Dr. Brock. What happens when toxins enter the body?
Well, Barry, the effect depends on several factors. In addition to the physical characteristics and route of entry of the chemical, the effect depends on the age, health, and any previous exposure of the recipient. The severity of effect depends on what we call dose response. That's a combination of the rate of absorption, rate of detoxification, and rate of excretion or elimination from the body. The human body has a marvelous ability to handle a wide variety of toxins in small quantities without permanent damage. Alcoholic beverages, for instance, contain toxins, and our liver is able to detoxify them, depending, of course, on how fast and how much a person drinks. Excessive alcohol consumption can cause chronic damage and even death.
Does the location of the toxin in the body have anything to do with the effect it has?
Yes, it does, Barry. We call that site of action. For example, if a chemical causes eye irritation, that's a local effect. A systemic effect, on the other hand, occurs when a chemical is absorbed into the blood and carried to other sites in the body.
By other sites, do you mean different organs like the liver?
The liver is one site. One way we classify toxins is according to the organs or other bodily systems they attack. Chemicals that attack the liver we call hepatotoxins, such as carbon tetrachloride. Neurotoxins like tetraethyl lead damage the nervous system. We call substances that affect the kidneys nephrotoxins, such as chloroform or mercury. Reproductive toxins can have an undesirable genetic effect. And lastly, as you saw, we have the hematopoietic agents like benzene and aniline. They cause changes in blood cells.
That's quite a rogues gallery, isn't it? With all these different types of hazards, how can we keep safe?
Well, although there are many different kinds of effects toxins can have, protecting yourself is a matter of knowing the hazards and taking some precautionary measures.
That's good to know. Thank you for joining us and sharing that knowledge with our viewers, Dr. Brock.
Glad to be of help, Barry.
If you're exposed to a hazardous chemical and experience some of the symptoms we've talked about earlier, it's very important to know what first aid procedures to take and then report immediately to a physician. Let's go back to check on George, the fellow who got sick while he was cleaning parts. We'll join him in the infirmary where he's been examined by the plant physician, Dr. Carey. Well, Dr. Carey, tell us what your diagnosis is of the cause of George's problem.
George had all the symptoms of exposure to a toxic chemical. It was the vapor from the solvent that he was using. We had the safety engineer check it out, and he found a concentration in the air much higher than the TLV, or threshold limit value, for the chemical. It turns out the ventilation system had broken down where George was working. That's why he was never affected before.
I suspected that was the culprit. What kind of treatment does that kind of exposure call for?
The basic first aid for inhalation of a toxic chemical is to immediately move the victim to fresh air. If he isn't breathing, artificial respiration is called for. If breathing is difficult, we administer oxygen. In case of skin contact, we would flush the area with water and wash with soap. And any contaminated clothing should be removed. If the chemical has been swallowed, we would check the MSDS to see if we can induce vomiting. With some chemicals, vomiting can cause further damage by attacking the mucous membranes in the throat and mouth. In George's case, he got himself out of the area in time to avoid serious consequences. How are you feeling, George?
Oh, much better. One thing's for sure, I'm going to steer clear of that area until they get that ventilation system fixed.
Sounds like good advice. Thank you both for joining us on the HazCom report today. Toxic chemicals can be dangerous, no doubt about it. But you can use the information on labels and MSDS to know what you're dealing with and how to handle it. U.S. Department of Transportation labels, such as these for a poison and poison gas, warn you that a tank truck or rail tank car contains a hazardous chemical. Many toxic chemicals are especially hazardous when burning, so the NFPA, or National Fire Protection Association, specifies this type of triangle-shaped label. The number codes in the blue area represent health hazards, with 0 being the lowest hazard, 1 being slightly hazardous, 2 meaning hazardous, 3 meaning extreme danger, and 4 standing for deadly danger. This is what an NFPA label would look like for allyl alcohol, a very toxic chemical. A 3 in the red area means it'll ignite easily, and the blue 3 warns of extreme danger. The yellow 0 means it is stable and not reactive with water. Of course, the MSDS is your most complete source of information about any chemical. To illustrate that, let's look at an MSDS for allyl alcohol to see how it should be handled. Remember our discussion of LD50, the lethal dose in test animals? Here it says the LD50 for allyl alcohol is only 140 milligrams when swallowed by a mouse or rat. Now let's look at the toxicity by inhalation, where we see that the TLV, or threshold limit value, is only 2 parts per million in the air. Obviously a very hazardous chemical. And how do you know if you've been overexposed to this chemical? It says the vapor is very irritating to the eyes, nose, and throat, and the liquid can cause severe burns to the skin. If someone is exposed, the MSDS gives the proper emergency first aid procedures. It's especially critical to understand and follow the personal protection, storage, and handling instructions found on labels in MSDS when dealing with highly toxic chemicals. You just can't afford to have a leak or a spill. And as with any hazardous chemical, a no-panic attitude and common sense are extra insurance against injury. With that thought, it's time to wrap up this edition of the HazCom Report on Toxic Chemicals. We've learned that no chemical is really non-toxic, but that many are inherently toxic and require very careful handling. We saw the symptoms of exposure to a toxic chemical, and we reviewed basic first aid procedures to take when someone's been overexposed. We learned about the routes of entry of toxins into the body. We discussed how different toxic chemicals affect the organs and other bodily systems. And we stressed that MSDS and labels give you the information to keep you safe if you'll only use them. In future programs, we'll talk about how to stay safe around other health hazards. In the meantime, I'm Barry Lerner, and this has been the 8th in our series of HazCom Reports. Thank you for watching.